Super important question. How does Social Security and Medicare work together for people with disabilities? So, Medicare is offered to individuals who are disabled. And the caveat for that is that it is available to them after they have been eligible for Social Security for 24 months. So, I'll just use an example. One of my clients had a stroke a couple years ago, 20 months ago. She's been trying to figure out how she's going to pay for her. She's 55 years old. She's been trying to figure out how she's going to pay for her premiums. Her husband's paying for them. They're very expensive. And given that she's just now been approved for Social Security, she's received a lump sum, and she's of 20 months. She's got 4 more months of payments from Social Security, and at which point her Medicare A and B will take place. So it's at that point where she can then enroll in a Medicare Advantage policy or a guaranteed issue gap policy. Now, bear in mind, the gap policies under 65 are designed for people with disabilities, and as such, they are more expensive. So that's part of budgeting that I have to do with my clients when they approach me with this exact question, is that they have a family member that's become disabled. How did they get Social Security, and how do they get Medicare? So they do work together very, very well. But number one, we have to have a disabling event. Typically, that's a point in time that's diagnosed and is documented through medical record, either through a hospital visit or through some medical notes. And then secondarily, we have to have a period of time to have Social Security benefits accrued, at which point we get Medicare 24 months after the fact. So I leave that with you. This can happen for people who have mental health problems if they're in their 30s. Usually that has to be accompanied with homelessness, unfortunately. But there's a variety of factors that result in the determination of disability. And note that disability can also be taken away. And unfortunately, I've had several clients where that's happened, and it's devastating. This is another part of public policy that we need to be very aware of, and know that it's not a guaranteed forever and ever thing. We need to be thankful for what we have while we have it. So I leave you with that. Thanks. Good question.